Although colorectal cancer is the second most common form of cancer, many Americans are not taking the necessary steps to prevent it, and early is key. Here to talk about what we can do is Dr. Krishnamurthy with Utah Gastro at Intermountain Medical Center. Thank you for being here today.
You're most welcome. Thank you for having me over.
Well, the second most common, so that's for men and women. Why is it so prevalent?
So, estimated about 1 in 20 Americans are going to be diagnosed with colon cancer in their lifetime. Why is it prevalent? There is some hereditary syndromes, environmental factors, lifestyle changes make you more and more prone for having these precancerous polyps. So, and colon cancer, even though it's the second most common, it's highly preventable cancer. If we do the recommended screening colonoscopies, it can be prevented.
When you say the word colonoscopy, I think there's some people at home that are cringing just the thought of it. What's that procedure like? Is it as bad as maybe what people have made up in their minds?
It is not. I get this question so often. With a lot of my patients ask me when they come to see me in the clinic, oh my God, please don't make me go through this procedure. And the same patients tell me after they're done, oh, this was not as bad as I thought.
Yeah.
So what it consists of is the preparation where you're cleansing out your colon the previous night, and you'll be on liquid diet, and you will be busy cleansing your colon out. The previous night is probably the toughest time.
Yeah.
And then you come and we give you a sedative. You'll be relaxed and you'll be asleep, and we'll go in, do our work, and we'll be done.
And
it takes
it.
about 30-40 minutes, yes.
So in the time of a TV show, you're done. This is not an all-day procedure.
No, this is not an all-day procedure at all.
Great. And so we just looked at some video of going in, doing the colonoscopy. What are you looking at? Is it important that we screenings before it's cancerous?
So most of the colon cancer starts as precancerous polyps. These are these abnormal growths on the inside lining of the colon, and we find it slightly more in men compared to women, and that's what we are going in looking for. So the recommendation for an average risk person, we have to start the screening colonoscopy at age 50.
At 50. So
Age
that's
50.
when you need to go in and have this done.
Absolutely.
And that's for men or women?
Yes, both.
Both. Okay, got it. Now, when we're talking about colorectal cancer, is this difficult to treat once you have cancer? So let's say you didn't go through the colonoscopy, you didn't do the early screening. How detrimental is that to your health later?
Absolutely. If we do the screening colonoscopy, sometimes we find them in early stages, and the 5-year survival is exponentially high.
Oh, wow.
When we find it in initial stages, meaning it's not spread to the other organs. And if it is, depending on, colon is an expandable tube, so sometimes you develop symptoms later. That's why it's important you keep on top of getting the colonoscopies done.
So just do it.
Just do it. Believe it or not, only just about half of the Americans get screening colonoscopies. So there is still 50% out there that's not getting it as recommended.
So it's only 30 minutes of your time that could really save you a lot of heartache, medical costs, pain down the line.
Absolutely.
And people can find you on your website.
Yes, the website is www.utahgastro.com.
There it is. Dr. Krishnamurthy, thank you so much for joining us.
You're most welcome. Thank you so much for having me.
Absolutely.